So what happens if you ignore your rotator cuff injury? Will this heal on its own? Occasionally it might. If that's going to happen within the first month or two. Hi, I'm Dr. Adelsheimer with Regenexx Pittsburgh, Southwestern Pennsylvania's premier provider of interventional orthopedics and orthobiologic procedures. If you had a rotator cuff injury and you're now more than 2 months out from that date of injury, the chance of your body healing this totally on its own is very unlikely. If you ignore this problem, you're going to lose function. Most specifically, you're going to lose range of motion, you're going to lose strength, which is going to lead to your inability to do things that require overhead activity, even as simple as showering, washing your hair, and putting an item up on the shelf. The more you ignore this problem, the bigger the problem becomes. So I definitely would not recommend just giving it time and letting it heal, especially if that didn't happen within the first 2 months. So who is a good candidate for orthobiologic procedures with us at Regenexx Pittsburgh? Somebody who has a rotator cuff injury that is not 100% torn and separated by more than 2.5 centimeters is a good candidate for regenerative treatment with us at Regenexx Pittsburgh. If it's having an effect on your ability to do normal activities, even combing your hair or placing items up on a shelf, if you're not able to play tennis or play golf or play other sports that you might enjoy that involve using your arms, if you want to get back to doing more aggressive activity, including throwing a ball, football, baseball, basketball shooting. So you are a good candidate for our regenerative treatment for rotator cuff injuries. So one of the ways that we determine candidacy is by looking at your MRI. So if you haven't had an MRI, come to see us and we can order the MRI. If you've had the MRI, bring the MRI with you to your appointment. We will analyze that MRI and we will tell you whether or not you are a good candidate for our procedures based on what that MRI shows. There are some very specific factors that need to be looked at in that MRI that will help us to determine candidacy. So if you've injured your shoulder and you've had an X-ray done and you've been told you have a problem with your shoulder but have not had an MRI done, we need the MRI to help determine whether or not your rotator cuff is injured. We can also look at it under musculoskeletal ultrasound, which we have in the office, which can be very beneficial. But in order to really measure the size of a rotator cuff tear, we need an MRI. And we will order that MRI, we will look at the MRI ourselves, we will also compare that to the radiology report, but we look at our films ourselves and measure these tears on our own. So you probably still have some ongoing questions regarding your rotator cuff problem. We answer these questions at our webinar. We will go into further detail about this. I highly recommend logging on to our webinar, and during that time we will present data specifically about your shoulder problem, and then we can answer specific questions regarding that. The link to register for our free upcoming webinar is in the caption below.